I'm going to talk you through what happens when you come to your IIH appointment at University Hospital Birmingham at the Centre for Rare Diseases. We run the clinic as a joint clinic between myself, Dr Sinclair, a neurologist, and Miss Mollen, a neuro-ophthalmologist. What we'll do is we'll initially bring you into clinic and give you some questionnaires to fill out, which help us to see how severe your headache is and also to give us an idea about how the condition's affecting your quality of life. We're then going to take you through and weigh you to work out your body mass index. Then we're going to take you through for your visual tests. To start with, you'll have an optical coherence tomography scan. This uses a light source shined in the back of the eye to tell us how severe the papilledema is and to measure the papilledema. Over time, this will enable us to measure whether the papilledema is improving or getting worse. It's a very quick scan and it doesn't hurt. Then we're going to take you through for your Humphrey visual field test. This will involve sitting and clicking a button when you see a light source shone in front of you. This will help to tell us if any parts of your vision have been affected by the papilledema from the IIH. And over time, we can track if you're losing vision or if your vision's improving. This can all take some time, but following that, you'll come into our clinic room and we'll talk about your symptoms, your medications, and then we'll go on to examine your eyes, looking at the colour vision, how your eyes move, how your pupils respond, which is the black part at the centre of the eye. From there, we'll put some drops in your eyes. These drops sting a little bit and they make the pupils much bigger, so that we'll then be able to look through the pupil to the back of your eye to actually see the papilledema and to give us an idea of how severe it is. But it will make your vision blurred for a number of hours, so you won't be able to drive home after your appointment immediately. It's useful to bring somebody with you for your appointment so they can drive you home. Once we've examined you, we'll go through the results of all the different tests you've had today, and we'll also talk to you about your headache severity scores and come to a management plan. We may also go on to talk to you about some of the research studies that we do in Birmingham. We're very passionate about trying to improve our understanding of idiopathic intracranial hypertension so that we know what causes the condition, why it affects some people, and therefore help to make new therapies and treatments to treat the condition. We're also very keen to run research studies and clinical trials using existing drugs and also weight modifications to try and tell us which is the best approach to treating IIH. We typically give you some information about the research, which will come in the form of some paper leaflets, and you'll have the opportunity to read through and see if any of them are of interest to you. If they are, you then may go on to meet with our IIH research nurse, who can explain these in more detail, so you can see if it's the kind of thing you want to get involved in. Sometimes when you come, we won't need to do all of these different aspects. But on other occasions, we will go through it all, and it can take a long time in our clinic. So we ask you to be patient with us, as you may well be here for a number of hours. But we hope that you will find the benefits of seeing both a neurologist, an ophthalmologist, a research nurse, and sometimes a dietitian helpful, all during the same clinical consultation.